All right. Hi, everyone. Good morning, good afternoon, good evening. I see people are joining in. Perhaps we can just wait a couple of minutes before we get started. Thank you.
Hi everyone, good to see you.
Hi, welcome. Welcome, everyone. I think maybe we'll just wait a minute or two and then we'll start, yeah? Just so that we have some more people. And I see people have already started introducing themselves in the chat, which is great. I was going to suggest that. So, yeah, I think as you join in, it will be great to hear where you're joining us from so you can, of course, introduce yourselves in the chat. Perhaps I'll get started just so that we have enough time for the dialogue. So, welcome everyone. My name is Anjana Varma. I'm currently the acting head of the Nature for Health Secretariat, which is based in the UN Environment Program headquarters based out of Nairobi. Nature for Health is, for those who don't know, it's a multi-partner program with seven organizations um, working at the environment and health interface to address, of course, broad health crises through a One Health approach. We really do focus a lot on addressing sort of the environmental drivers of health crises and looking at upstream prevention. So we started this dialogue, and this is the second one. But we started this dialogue on upstream prevention really to talk more about it, to kind of break it down, and to bring the different partners, different expertise into this space. We've seen with our program with Nature for Health that we do have, of course, expertise from across the place, from health. We have WHO and World Organization for Animal Health and a lot of organizations, but I think we still struggle to really understand what we mean by upstream prevention or prevention at source. And so we would really love to go deeper into this space, but I'll reserve that for our speaker for today. And so I'm very pleased to have with us our speaker, Chris Walzer, who's the Executive Director of Health from the Wildlife Conservation Society. He is also, of course, a wildlife veterinarian by training, and he brings a lot of rich experience working on wildlife health, biodiversity, ecosystems, and emerging diseases. I think I don't want to take up too much of everyone's time because we want to have some time to have a bit of a dialogue. And it would just be just for you to know, we'll just spend about 25 to 30 minutes or as much time as you need, Chris, for the presentation, and then we'll open it up for a Q&A. Um, People are, of course, invited to put their questions into the Q&A box that you'll see up on the top bar area or in the chat itself.
At the
Hey,
moment,
And Jana, I apologize for interrupting, but
yes.
there appear to be two different links going.
Yeah.
And
So
there
let
were
me-
some people on another
Let me check
call.
with let me check with the team, the core team who's organizing this, and I will get back to you soon.
Oh,
Yeah,
no.
I have two screens open with different people on the two, and
gosh,
they're both under the
let's see.
M for H webinar. So
You are
maybe we
mute,
can give it
Lucy.
5 minutes.
We cannot hear you.
Yes.
Hi everyone. I think the other link needed to register and join. So the other one was just a placeholder as a meeting invite. So you needed to click and join.
It's a different meeting, and everyone can see
Yeah.
me talking and it's telling me I'm on mute, but I am on mute on that one.
Maybe your sound will work in the other link.
And they're telling me that they're on a different meeting to everyone else. So I don't know what's quite going on.
Could we try, Judy?
Natish and some others are on the other one. So if anyone can reach out to Natish and let them know, that would be good.
Could
And
we
maybe
try
share the link to
perhaps
this
to-
one.
Sorry, could we try, Judy, if you could share the link for this invite to those participants in that other webinar, and then we ask everyone to join this one. Yeah, there must have been some glitch here because, yeah, this is a bit, I don't know, I don't know which one I'm in, but
Yeah, and I can't seem to flip back to the other one. But yeah, someone just Kim just
Yeah,
started the other one again.
That's weird. Oh, I know we're okay. All right.
yeah, okay, let's wait a couple of minutes. Apologies for that. And let's just try to get everyone to this one.
It's a practical example of the multiverse, multiple things happening at the same time, different trajectories. This is
That would be terrible.
that's the reality.
Hoping people are able to join this one.
Yeah, I just saw Lucy start the other
So I've just
meeting
shared a
again.
link. Kindly
Yeah.
click on that link.
Sorry?
Lucy is in the other
That's where we are
call,
in.
sharing the
everyone
link
is.
to this meeting with everyone and asking them to register and join this one right now.
Okay.
I can
Okay.
hear the other one, but I can't see it anymore, which is very odd.
Okay. Oh
We can hear
gosh.
you. We'll register.
Okay, perfect.
Okay, I would suggest we start because I don't want to lose out on the time that we have. And I'm hopeful that others will be able to join and catch up. We will have, of course, the the presentation and the information, the webinar recording available later on as well. So I think that should also help. But really, apologies for that confusion with the different links. We'll need to see what happened there. But I wanted to just hand over to you, Chris, to present to us on, of course, the work that WCS does with upstream prevention or prevention at source. And we'd really love to hear your experience in this space and learn from you. So over to you. Thank you so much.
Thanks very much, first of all, for the invitation, and thanks very much for the introduction. I'm going to share my screen right away. And let's see if that works. All right. Can you see the screen? Can you just confirm that? Because I can't see anything. All right.
Yes. Yeah.
Welcome, everyone. Good morning from the Bronx on the east coast of the US here where I'm based. Good evening, good afternoon, wherever you are. Thanks very much, as I said, for this invitation to talk about prevention at source from the health program at the Wildlife Conservation Society. Just as a get going, I want to be very clear. I often, I'm talking on behalf of a lot of my colleagues, a lot of the inputs and actual project work happening around the world is being carried out, not by myself, of course, but my colleagues that are based out there. So my thanks to all of them. For some of them I saw are joining today as well. So just to be very clear on that. So WCS, just a quick introduction. We're talking about health. I understand this concept, most of you probably do know WCS, but I'll just give you 2-3 minutes introduction to where the Wildlife Conservation Society works. So as you can see on this map, we're sort of pretty well distributed in basically all the biodiversity hotspots, if you want to keep it that simple. We don't work, what's important is we don't work in the lower 48, except of course on things like policy or in Europe or in Australia. While we have offices in Europe, they're really focused on policy, but no work on the ground there. We work in about 57 countries, and when I say work, one of the things that's important, I think, about WCS is these are long-term commitments. It's not like we have a project in a country. We're talking about infrastructure, many decades of partnerships with the respective governments and agencies in those countries. The metrics are always, kind of impressive when you look at, how much land is being protected and obviously carbon sequestration and so on. But most importantly, it's about the people that we work with. We're about 3,500, 3,800 individuals on staff across the globe. 90, more than 90% of the staff is national staff. We work with a lot of local partner institutions and organizations, of course. And then, as many of you probably know, WCS has always had this very strong science-based approach or science-informed approach. So many scientists. Someone's got a microphone on and I can hear them in my ear. Please, thank you. So a lot of scientists. And as I was saying, one of the things about WCS, which maybe I find differentiates us from maybe some of the other conservation organizations, is really long-term commitment on the ground and working in these countries for decades. I think we've been in the DRC for 70 years plus, Peru, I think 60 plus years, and so on and so forth along those lines. And often these country programs are quite substantial with hundreds of staff members on staff there. So the other thing that's interesting, we're talking about health today. WCS is sort of one of the unique things I think about WCS is we have a long-term commitment to health and an integrated health program across the organization. And we're basically one of the One Health founders with the Manhattan Principles, which is now more than 25 years ago, which were drafted, sort of the first framing of a One Health approach. And that was up updated again in 2019 and so on. So it's not a static process, but these Manhattan principles, which were formulated back in as I said, 25 years ago, sort of helped build the systems-based approach to health, a sort of a more holistic approach to health. What's also interesting about an organization like WCS for health is that we're inherently a multi and transdisciplinary group of individuals that and employees that work in many, many different fields. So as we're going to be talking about prevention at source, you're going to see how important that aspect is of how health is just an integrated part of a larger transdisciplinary approach. As I said, science is at the basis of what we do. And so, the place-based knowledge, trying to integrate other ways of knowing. And I have to always admit, this is not an easy process, but we'll try to discuss some of that as we move through this presentation today. I also want to take a few seconds just to talk about how we approach health generally. So for us, what's really important is that we have a systems-based approach to health. We sort of recognize that health is embedded as we all know, in multiple crises, in a polycrisis situation. We have climate emergency, biodiversity loss, pollution, massive global inequities, and then increasing issue is myths, but more importantly, disinformation around health as well, which is causing, much larger impacts, I think, than you would think. So keep that in mind, that it's basically a systems-based approach to health, and then we'll talk about the framing that we use before we move on. And I think the Ebola, the Bundibugyo outbreak of Ebola is really a really good example, right? You could look at this as a emergence of a rather novel or at least a rarer pathogen. But the problem is where the socio-ecological context where this pathogen emerges, right? This is actually what determines more or less the consequences and how consequential this emergence is. It's in an area, as you know, in Eastern DRC, it's armed conflict, lots of insecurity, tens of thousands of displaced individuals and persons in that area. There've been massive decrease in investment in that area with ODA. USAID has completely collapsed there, so the infrastructure has been destroyed. The workforce doesn't exist anymore, and then of course it's just per se it's very remote, difficult access in many of these areas, limited laboratory capacity. So the idea of a systems-based approach to any kind of health thing, be that in humans or be that in animals, is really depends on that socio-ecological context. And I'm just going to show you, we do use within this systems-based approach, we do use a One Health framing. And I just like to always use this. You've all seen this very useless, actually, Venn chart, right? So this is something that we should really banish, right? We shouldn't be using this because it sort of implies that something very mystical and mysterious is happening in the overlap area, but we don't have to worry too much about what it is. So we'll just get rid of that. And one of the things we've noticed together with colleagues over the years is when we talk with agencies, donor and governments, that they're very confused if we talk about One Health and we show a Venn diagram or anything like that. So we've sort of moved towards a description of where we really try to bring in the prevention at source and how foundational this is. What you see here is a generic continuum of care, and from a public health perspective, you could also frame it as the social determinants of health, basically. And what I like to tell at this stage is, when I was a kid, my father would be smoking, 40 cigarettes in a car with us sitting there without seatbelts or even playing on the back of the thing. That's what, there was no prevention, right? And as I've got older, as we've all seen, that continuum of care is expanded to recognize more prevention, to recognize inequities, and so on. And what we suggest, and this is the way we try to promote the prevention at source, is that we just expand this continuum of care, and to include the foundational importance of the natural capital and the assets, these foundational assets for health for all, right? So you expand that continuum of care to include the environment, in the sense that we on this call understand the environment, and much expanded over the concept of environment as it is in traditional public health. Now, one of the things that is important also when we talk about One Health is there's been this, in the last decade, 5-6 years, of course, there's been this massive focus on infectious disease. And though we will talk a little bit about pathogens today and spillovers and things like that, it is important to remember that you need a systems-based approach to health also for non-communicable diseases, right? And it has to be expanded. This is really important to not get focused on just infectious diseases. It's really hard, right? Every time we try to move away from infectious diseases, we'll get another outbreak, right? And we've been faced with Mpox, Marburg, now we have Budibunyo, and we have measles everywhere, and so on. So, these infectious diseases that we thought many, probably 10, 15 years ago, that we sort of got over them, these are really come back with a vengeance. I just have to point that out. The other thing I want to just spend 2 minutes on is, when you think about a systems-based approach, especially from an environmental component, one of the components that's always really difficult to get a handle on is in environmental health. And at WCS, because the environmental health is also that foundational aspect to the holistic approach to health, or to a systems-based, where does it start? How do we measure it, and so on? And I honestly, the metrics around this is something that we still probably need to put some thought in and develop. But one of the things that we use now is this idea of the exposome. This comes from oncology. It's about also 20 years old. 20, 25 years old. And if you think about it, when you go to your GP, they're basically trying to find out a little bit about your exposome. So if you always have to fill out that chart. It says, do you smoke? Are you stressed? How much do you drink? And so on and so on. What they're basically trying to find out is the compounding exposures you as an individual have exposed yourself to or have been exposed to. And the thing about the exposome is that it's a really good tool to approach the health of the environment. So just leave it out there. You'll get these slides anyway, and you can look at it. But basically, the landscapes that we work on, these basically everywhere multi-use landscapes, have compounding impacts on them that we need to be aware of and that we need to consider when we talk about prevention at source, right? These impacts on the landscape obviously have direct impacts on the microbiome and on the wildlife that lives there, on the individuals that have to live there, and so on and so forth. And it's also, I think, a very good tool that helps us better understand our intergenerational responsibility, right? So while we discuss a lot about the historical impacts we've had in colonization and so on, what we're now doing is we're clearly colonizing the future by exposing and impacting landscapes, right? Be that AMR, be that PFAS, new pathogens, and so on, right? So this really does help us frame and describe what we're doing. And obviously that helps us mitigate and alleviate these impacts as well, or at least work towards mitigation. Now, when we talk about primary prevention, I like to talk about interfaces. It's easier, I find, to frame around interfaces. As a conservation organization, we're constantly working on interfaces, and these interfaces are constantly changing. I'm sure many of you or some of you on this call have seen this slide. This is always my favorite slide, and I've tortured people with it all the time. But you're talking to the Ministry of Transportation, and they're just very excited that they've built this road from A to B, and it's going to increase economic development at whatever happens up there in the clouds. But when you look at it from an epidemiology point of view, from a primary prevention point of view, what you have created here now is a new interface of hundreds of kilometers to previously, let's pretend, a pristine forest and everything that is within that forest, of course. So this is the importance about and how primary prevention often, from a health perspective, gets relegated or completely ignored, right? You build the road, but you don't think of the consequences. Now, what we've done at WCS, we've first of all built a suite of tools that help us try to grasp what's happening at these interfaces. And these tools, I'll go through these tools in a bit of detail. They're sort of summarized in something what we call the Wild Health Net, which has about a different suite of tools. And the importance of this is it fills a gap that just had not existed, right? Anything that deals with wildlife health and environmental health was like a gap between the established public health systems in a country, often focused very much on the large urban centers, much less activities out in the rural areas or in the areas where protected areas are and so on. And these tools basically have sort of four components. One of them is to try to establish environmental health and wildlife health surveillance and framing so that it can be scaled in national policy. There's obviously a capacity bridging and a training aspect to that. There's a whole data collection. We could spend 2 hours just talking about the gaps in data collection, data sharing, and so on. I'll just be able to touch on it shortly. And then, of course, the response as well when things are detected and then need to be mitigated. What's important for us is that this is not something we do alone as WCS. That would make absolutely no sense, right? We're embedded in a whole system of different agencies. WOA has been brought up today, obviously UNEP and WHO, FAO, and so on. So this is all structured around a community of practice that has helped develop this interoperable wildlife health data system. And that sort of supplements existing or bridges the gaps in existing systems of health data collection. One of the most important things has been also harmonization of data. Many of you who work with data know the problems of, the PDF prisons where the data is just embedded and you can't ever do anything with them. It's impossible to share different framings and different ways of collecting data and so on. So this is important, and most importantly, this is something that we discuss with our partners, be that FAO, WHO, WOA. Many people have come around to try to harmonize this approach. How does this work in the end? So one of the things that we recognized many years ago is that we have a workforce that are on the front lines of any kind of health emergency, basically, that is not being covered by any other one. And that is our eco guards, our rangers, our staff in protected areas, in all different types of protected areas and so on. And these are thousands of individuals who are constantly moving in these areas, who are doing patrols for, anti-poaching patrols, ecological surveillance, and so on and so forth. So instead of developing a completely separate system that would be completely novel, we focused a lot on empowering or building on the strength of this workforce, and integrating health monitoring into the existing, basically patrolling and activities that were already ongoing. And we use upgraded or modified SMART, works for, and nowadays also with Earth Ranger, of course, to integrate health. And the key workforce here are really the rangers or eco-guards, depending what they're called in different lands. And they allow us to detect these signals of health activities that are health events that are happening in these remote areas, and there's a system to report back on that area. And this has worked quite well. It's not as easy to set up as you would think, because it has to integrate within the national public health system, the existing livestock health systems, and so on. But a very good example is one of them, the protected area monitoring network they've now set up in Peru. As you can see, they've recorded some 2,000 health events at the front lines in over 100 species across the national parks. And I just want to point out how this always starts. Originally, we got funding to do this in like 1 or 2 parks. And then the government approached us and said, we really like this. Can you do this for the other 72 protected areas without increasing the budget? So this is one of the problems that we do have. As governments recognize the importance of building up these sort of primary prevention or at-source prevention networks, the funding is still massively lacking to build these things up, right? So the other one, of course, is this ever-expanding wildlife-livestock human interfaces. And I'm really focused here a little bit on the wildlife-livestock interfaces. So more and more encroachment of livestock into wildlife habitats, and the sharing of diseases, be that directly or over water points and so on. I'll just use a species here because it's one we don't always talk that much about. This is vicuña in, this is a picture from Bolivia, but it's a species that ranges across the Andes. And this species has been, as you know, it was at the brink of extinction or was highly threatened because of poaching and so on. This is a species that then recovered across its range, and now in the last decade or more has been massively threatened by sarcoptic mange. And this is a disease that it would share with livestock, for example, with alpaca, llama, and so on. So we've been working across the countries there to develop, first of all, the diagnostics. This is very difficult to recognize in the wild. Most animals were only recognized when they had massive amount of symptoms. There was a lot of training with the communities that are very dependent on the fiber that they harvest from these wild populations. And then this developed with the communities, co-developed with the communities, better management practice. This disease is very easy. It's a parasite. It's a very small mite, and it's easily transmitted with contact. So if you drive all the animals together every 2 years and harness the fiber, you do actually transmit the mite. So working with these communities at very simple preventive measures has massively decreased, on the one hand, increase the recognition of the problem, and that something needs to be done. And on the other hand, management practices have helped decrease the impact of these diseases. So that's it. And then, of course, you're all aware that we've had other livestock diseases of really great importance with massive impacts on biodiversity, African swine fever spreading out of Africa across Asia, impacting all the endemic species in Indonesia, Philippines, and in parts of Malaysia as well. So we've seen massive die-offs at the moment. For example, Babirusa, we're not detecting any more Babirusa in the wild in some of our areas after African swine fever arrived. Same for Peste de Petit Ruminant, impacting Saiga in many of the mountain ungulates across Central Asia. They are naive to this virus, and the impacts are massive. And management and primary prevention here to alleviate contact between livestock and wildlife, or vaccination of livestock to protect the wildlife is another. And then one of them, there's an important one is screwworm, the New World screwworm, a parasitic fly which is expanding from across Mesoamerica. And today, actually, I saw that the first case was detected, or the first case acknowledged in the United States, in Texas. So it has spread all the way from Honduras up in through Mexico into the United States. And this is a massive impact on livestock. But as we show in just a recent publication, should be available online in a few days, also potentially impacting wildlife as well. One of the things here as well that we see, and I don't have that much, I don't want to talk that much about new technology and so on, but one of the things that we do have now, because of these, as you know, in the conservation field, we use a lot of camera trapping data. That paired with AI allows us this very early detection of some of these diseases that impact livestock, or in this case, wildlife, and harnessing this knowledge we have over decades of improving our camera trapping data and then the analysis by AI is something quite novel when you look in the public health or livestock health fields. Then just want to continue. Obviously, primary prevention is also really dependent on the behaviors, practices, and policies that we have. And there are just certain things that we humans have developed, which are just, I mean, this is silly, right? These are not historic pictures. These are from a few weeks ago in Indonesia on the right. These are markets. And if you look at this, you have macaques, you have civets, you have ducks, you have everything. They're alive, right? They can share viruses, they can develop new ones. So this nexus of live wildlife trade and conservation and health is something we've been working on a lot. And as you know, for a virus to spill over from one species to another is actually not easy, thankfully, right? Many things have to align for that virus to get across. But if you remove many of these barriers, it's you're just facilitating this spillover. You're making it so much easier, and you're providing so many more opportunities for this to happen. And some of our work, and this is one of these advantages of being inherently a transdisciplinary organization and working with our partners as well, is that we can use our work on counter wildlife trafficking, and pair that with work, health work as well. And we can show how coronaviruses increase along the wildlife supply chain. In this case, of course, that rat down there, which is nicely fried and is perfectly safe, but everything before that thing was fried constitutes a serious risk, of course, along the way. Different communities, but similar problems, right? Depending on where you use wildlife, the impact of pathogens is a worry to the communities. The dynamics of changing, climate change, encroachment, and so on, as changing these dynamics of shedding and sharing pathogens across there. We also, as I said, use our counter wildlife trafficking insights and pair that with disease investigations as well, and can look at. And it's really important is to understand that this surveillance is important to understand what is even going on, because you can't do primary prevention, or you can't do any kind of prevention if you have absolutely no idea what's going on, right? So understanding these networks and the sharing is essential. Then, of course, work with communities, and that can be very simple as with more than 25 years of working with communities in the Northern Republic of Congo, I think some 600 communities, and building on the strength of these communities and also really acknowledging, you know, the various cosmologies and that sort of have to be considered as we work with the communities. But in this case, just providing general information about Ebola emergence, you know, the do's, don't, before it emerges, right? This is very different. Once there's an outbreak, this is not quite as relevant, but this is sort of a really preventive measure long before it's happened. That's then paired with carcass, on-site carcass sampling. When this started, it took about 3 months to get a diagnosis. Now it's 24 hours or even less, because carcass side sampling is about 45 minutes, and then it's confirmed with the increase of capacity over the years at the National Laboratory in Brazzaville. So it's really quite impressive if you think about it. It took about, you know, like I said, 3 weeks, and now we're at a few hours to get it done. So, and that's obviously important, as you saw with the recent outbreak and the ongoing outbreak in DRC. Time from first diagnosis to implementing a response is the critical measure, right? In this case, it was up to 6 weeks before it was recognized. Then there's also site level work around protected areas, working with communities to improve not only the health support for the employees, but also their families and all the community members that live around these protected areas, frontline clinics, access to healthcare, information, vaccination, and so on and so forth. So that's another aspect of very primary prevention to reduce the risk in these areas. In this case, around Ndoki, there's more than 3,000 people living around that park that previously didn't have access to much healthcare at all. Then, of course, in other landscapes, different approaches, working with Native Alaskans and Inuit in Alaska. I think the main thing I want to say just very quickly is what so generally donors and generally do not recognize how much time and effort is necessary to build true participatory community primary health or primary prevention community programs. It does take a long time to build the trust and the networks, and we hardly ever have funding or even recognition that this has to happen, right? And then there's this sort of, well, go there and talk to them and give them a questionnaire. That's not how this works, right? This is an investment of 1 or 2 years before you can even start implementing a project. I'll just skip over the tech. There's a lot of tech here as well that's improving our capabilities on the front lines. Things are getting smaller and smaller. 20 years ago, or even 10 years ago, samples had to be moved into the US or Europe to be analyzed. Now, basically, that never happens anymore at all. Everything can be done in the country. We already talked about the camera traffic. And then all this work, of course, this primary prevention work and the information that we get needs to inform policy. And I think this has been a big change for us at WCS as well, is how much we've been involved in health policy and supporting, for example, CBD or the pandemic agreement and others, and developing or supporting as policy and agreements are negotiated. Being in the room as the experts with a long-term commitment, long-term experience on the ground at these, what I would call the front lines that practically no one else is working in at the same time. And bringing that to these agreements and helping that, framing that. So we really did invest a lot of effort in the pandemic agreement to make sure that the environment and primary prevention basically is in that agreement, that there's a holistic approach to health, and that it's not a traditional public health focused approach, which makes absolutely no sense would make no sense in a pandemic agreement where most of the pathogens you're going to face are going to be coming from wildlife. Working with the IUCN, developing framing to better understand the drivers of disease emergence in protected areas, how protected area managers can use this toolkit to identify activities, One Health activities, and further One Health capacity in protected areas. This is recently, you can download this report. It's very, very comprehensive. My Skylar Hopkins and Sarah Olsen co-chaired this and did an amazing job pulling it together. So it's something really to look at. And it's really primary prevention and coming from protected areas. As I said, building national policies, trying to get these standard operating procedures into national policy. And unfortunately, I've been using the same slide for a while because this is actually quite difficult, right? It's not like every week we manage to convince a government or something to develop a national policy on environmental and wildlife health monitoring and integrating that with their existing methods. But when it does happen, of course, it's fantastic, right? Because then it's sort of written down in some kind of at least agreement, or even better, in legislation, right? And then finally, training, capacity building, and bridging is an important thing, important activity, of course, that we do, and that's the sort of a constant integrated in the work we do. And I just, I think one of the things that we do need to think about moving forwards as well is how we've, coming from a conservation organization background, I think this would also be important for multilateral agencies to also inform academia and the training of professionals that are still being trained along the lines of a world that doesn't exist anymore. We do need different knowledge, different capacity nowadays coming out of academia, much more focused on sort of transformational change, transdisciplinary approaches, and so I think there's something to be done there as well. And just leave that. And then I'd like to finish with this one. When we talk about health, we must never forget it's a human right, okay? I think it needs to be viewed as a global common good. And in contrast to all the discussions about the costs of healthcare, I think we need to reframe this. We always need to point out that actually health is an asset. It's not a cost, right? It's really, really important that the alternative to health, lacking health, that's a real cost. Not forget our intergenerational responsibility. This idea of colonizing the future needs to be on our mind all the time. And it's also about interspecies health equity. I know that's always at the bottom of the list because it's really hard to get across when you're having a discussion with the Minister of Health in some country. The last thing he's particularly interested is going to be the health of some wildlife somewhere. So, but keep that in mind as well. So thanks very much for that. And I'm really looking forward to discussing that with you all.
Thank you. Thanks very much. This is fantastic. Yeah, I think I really appreciate the complex dimensions that you brought into what you were presenting and the very concrete examples. So thank you so much for that. We really appreciate that. I think you talked a lot also about bringing it down to the context level. You highlighted Peru and other examples. So that was really useful for us. A lot of the people who are in this call are actually sort of focal points from our partner organizations who have been very closely with the countries they're working in, developing these proposals. And I think that's something we've seen also. You talked about how doing this well takes time. Building the capacities with communities and building it together with them takes time. I think with Nature for Health, that's something we've seen. In our second phase for Nature for Health, we've actually expanded the the timeline for the scoping period to up to a one year, because I think we also see that it is an investment. It takes time to do these things. So really appreciate that. I don't know if there are any questions already. Please feel free. For me, there were, I think, maybe just two things. I think wildlife health monitoring is definitely a piece that we've seen is often missing in a lot of our, when we come across a lot of the One Health projects, whether it's, I don't know, not a lack of understanding, capacity issues, funding issues that you also spoke about. I'm just curious to see how you would think, we could piece these things together into sort of the more traditional One Health efforts and projects that we've seen. Oftentimes they say, prevention is sort of an invisible thing, right? And it would be sort of good to know, how do we concretely convert the urgency of this work into more funding, or translate it into budgets in the ministries and stuff. That's always a challenge, I think, more on the environmental end, getting everyone to see the relevance of this work. But that's just a thought. I don't know if you want to respond to that already, but I do see there are some points coming up. Maybe we could actually go to our colleagues. Carlos, do you want to jump in? Feel free. And then there's a question from Claire. We can get to that after that. But Carlos, over to you.
Thank you very much, Anjana, and thank you so much, Chris, for this very comprehensive presentation. Really appreciate that. And one of the points, it has been already mentioned in the chat box, but really will be grateful if you could elaborate a little bit more on this. Cannot do upstream prevention without the surveillance. As we know, many of the countries that we work, there is the need of this information. There is the need of, trying to understand where this interaction happens. And it will be great to understand what is the middle point. But also, I saw that there is a need also to showcase this is at the local level more than the national level. So what is the middle point between how much surveillance do we need at the national level, for example, to gather the enough data that decision makers will need, and to have to showcase what we do in the field, because this is an ongoing conversation that we are having with the Secretariat also, on how we are going to move forward with one of these the countries that we are working with. So really will be great to hear your thoughts on that. Thank you so much. Over to you.
Yeah, thanks very much, Carlos. That's a really good and obviously a question that we could spend 2 hours or 3 hours talking just about that. So information, of course, is the basis, right? We all agree, without working in the blind makes absolutely no sense. One thing that we've learned over the years, of course, is that surveillance and data collection needs to be agnostic. So in the past, if you think back 10, 15 years ago, there was a big focus on, we're going to do surveillance for this pathogen or that pathogen, and so on and so forth. Nowadays, there's a real big shift, first of all, to a much more local, with local capacity, with a short turnaround within the country without anything having to leave the country. That's one thing I think that's really shifted, and that gives you more control and agency over the data you're collecting. And then it should also be agnostic, so that you could pick up things you don't know, right? Instead of just amplifying what you already know. That's, I think, one of the most important things. Building up the system then within your region locally is absolutely a process of co-development. You do need to spend that time to build the trust and decide on what is important for you in that context. And it's very different, of course, in Alaska. The interest, what communities are worried about and want to know about in Alaska is going to be very different than DRC. And that sounds like a stupid thing, but it is actually the context really frames on what you need to do. I think that's the most important. The tools are there, honestly, nowadays. So we do have the tools and the data harmonization and sharing, and so that's in place. It's about investing in that trust, investing in building that community at whatever scale you want to do it. I don't know if that catches what you want. And the other thing I do just want to say very quickly, we talk about primary prevention, but remember, all of this is a gradient. It's not like there's a box and this is primary prevention. There's another box, which is secondary prevention, and then there's preparedness and response or whatever it is. It's a gradient, right? And that gradient shifts also with context. Just keep that in mind as well.
Thank you. Yeah, no, I think that's a great way to put it. And I think that also perhaps sort of speaks to Claire's point or question there in the chat box about whether wildlife health surveillance is a key component to inform and allow upstream prevention. But like you said, I think it's very context specific, and it's really about building something that works within a specific context. And surveillance and even wildlife health monitoring could, I guess, be complementary to actions that are taken on the ground at that level. So I think that it's a very nuanced picture. I think that's what we're what we're getting from you. Maybe
Just
very quickly,
if I may add
yes?
to my point, I was
Sure,
just
go ahead.
questioning how can we properly do upstream prevention when we haven't characterized the hazard, and
Exactly.
doing this
Exactly.
needs wildlife health surveillance. So
Yeah.
it's.
And I think, there's an interesting discussion to be had, and I think this would explode this webinar right now. But, we have the hazard. Many times, Claire's point is really important because many agencies and project developers have not even understood the difference between hazard and risk, right? So it's all convoluted and mixed up. What we do is we want to determine the risk so that we can work on mitigation, because these things happen at certain areas. There's a certain area, contact areas, interfaces, and so on, and it's the practices, behavior, and policies that happen on these interfaces which determine if something happens, right? So you have the hazard, you have this contact area, and the policies around that, and then you have that determines the risk. But there's another thing, of course, we always have to remember, which we also need to consider, and that is uncertainty. Right? We can talk about risk mitigation and de-risking, and we love to do that, right? Humans are great at doing that. But sometimes it's not about risk, it's about uncertainties, which is something very different. We need to also consider that. Mm-hmm. And remember, this is not only about pathogens, right? So this upstream surveillance will include mercury, PFAS, AMR, all the other risks which are compounding on those landscapes. And honestly, that's impacting the most disenfranchised communities first, always, right? It's not me eating the mercury, it's the indigenous communities along the Putumayo River, which have got 10x to 100x mercury contamination every day in their food, right? So, sorry, I can go on about this one.
No, it's very, very interesting. And I'm just mindful of the time. I don't know if people can stay back, and we try to maybe stay 10 minutes and just finish off if that's okay. Alex, maybe I'll come to you quickly. And I see there's also a question from Rumbi right after. Go ahead.
Yes, good afternoon, good morning, everyone. Hi, Chris. Thank you for your presentation and recognizing the great work that WCS has been doing all over the place for a great while now. I just want to discuss a bit some what I feel as a kind of vocabulary issues. When we talk about health, when we talk about prevention, I mean, and when we talk about surveillance, I want to be that we are clear about how we use health and how we use disease. Of course, health it's much larger than just diseases. And so when we talk about health, and if we talk about wildlife health, this is not just looking at wildlife diseases. It's more about looking at the sustainability of wildlife population, their healthiness, the good quality of life of wildlife, as much as we apply the health definition to humans. So when I see wildlife health surveillance, for me, it's a bit tricky because I apply the same difference between surveillance and monitoring. You can survey disease, but you monitor populations. So wildlife health monitoring, I'm okay. Wildlife disease surveillance, I'm okay as well. But wildlife health surveillance, And the last point is about prevention. We've heard about primary prevention and upstream prevention. Primary prevention is a definition from public health, and it's really trying to prevent disease injury before they occur. So it applies well to spillover, to the interface, and trying to prevent the spillover that can trigger an epidemic and a pandemic before it happens. But in the framework of Nature for Health and the Technical Advisory Group, we try to define upstream prevention much before the interface, much before the spillover. So, and trying to root or anchor our thinking within the last IPBES reports, the nexus and the transformative change. How do we make sure that our footprint on the environment doesn't create risky interface where animals, livestock, humans will be exposed, and different groups of humans and different groups of animals will be differently vulnerable, because there is also the vulnerability aspects of exposure that is very, very important. I will stop here, but just trying to, discuss those.
So this is fun in the sense that I have a certain amount of time that I can talk, and normally I do a much longer introduction, and I always have this slide. This is what we say health. So basically, Alex, I love your question because it goes at the key, and I think this is the most important. We often skip over this and then talk about things we do, not thinking or not making sure that everyone in the room or on the call is on the same board, right? And that was a sort of a trade-off that I did here. And I do this internally as well. So for us, health is the capacity to cope with the now, and the capacity to cope with an uncertain future, right? It's as simple as that, right? That's our comment. We would use fitness basically as a health proxy, but because we also deal with livestock and humans, that doesn't really work so well. So it's that capacity to cope now and with an uncertain future. It's really, really basic. The point and the reason we've moved to the exposome, and we talk a lot about interface here, and I realize, and I was told by others, don't talk so much about interface, they're not interested in that. The problem is, every time we try to move back and start talking more about the exposome, loading the landscapes, the changes in landscape, use, encroachment, and so on, changing patterns of livestock, of wildlife movements, all these kind of things, we get another outbreak of some epidemic, some kind of infectious disease, which sort of sucks the air out of any kind of discussion on a non-infectious thing, because that's what everyone wants to know, right? Everyone wants to know. That's what the funders want, what the donors want. So we keep getting pushed back to that, right? And I can tell you the last 6 months is, we've had Hunter, and now we have Ebola, and it just never ends, right? So I am driven by that, I have to say. It's not a choice. I would prefer to spend more time thinking about it. But I think, we can look at work on changes of primary habitat for bats, how those have shifted, and how we can mitigate that. There's a lot of things. I'm fully on board with what you say, Alex. It's true. It's a trade-off of what you can do in a certain amount of time, I think.
Thank you very much. Yeah, I think that's thanks for bringing up those very distinct points, Alex. I think vocabulary might be an issue here, definitely, because I was also thinking that perhaps we need to have a stronger distinction when we talk about monitoring versus surveillance. And I think from our end, with the environment really being the key lens, we look at sort of, we would say that biodiversity action is sort of a public health measure. And it's not really, the absence of disease, but really creating the conditions through action on the environment where communities can thrive. And, your health is about thriving, not just sort of the absence of disease, and trying to shift that narrative very much. So, so it's really quite interesting that you brought up that point. I am mindful of the time, so I'll just go to the last question, if that's okay. And
Could I just add something, just something really
Yes,
important to say, right? Just think, if you think about that, our definition of health, right? It's the capacity to cope, right?
Cool.
That's the idea, right? So it has nothing to do with disease, right? Because the day you were born, you're starting to die, right? Just get that. That's clear for everyone. And the day you are born, you're getting compounding impacts. What we have to consider in the health thing is to mitigate those compounding impacts, be they infectious, non-infectious, and so on and so forth. You do that on an individual level or on a population level, depending on the context, right?
Yeah. Thank you. I will just quickly go to the last question I see here from Rumbi, who is also in our technical advisory group for Nature for Health. And she's asking that, so indigenous people, local communities, youth, women, and all bear the immediate socio-economic impacts of natural resource regulations, including deforestation, illegal wildlife trading. How do we co-design upstream prevention protocols so they can protect local food security and respect traditional ecological knowledge rather than imposing top-down restrictions?
Well, yeah, this is the key question. This is, or at least this is the framing that I'm trying to get across. This is all a question of co-development, right? And you need to invest the time. This idea of we come there and anyone goes into a community and thinks they can understand a community in a week because the donor told them to send them a questionnaire. That doesn't work. You do need to spend, Alex is a good example of this, who spent, I don't know how long with the communities he works, but many others here as well. This takes time. It takes the appropriate, the context-specific approaches to listen, to hear what the community needs, to look at the legislative framework around where the community is, but also at the same time to acknowledge that the world has changed, right? So an indigenous community, which is 25 kilometers away from an international airport, is different than a community which is 5 days walking away from an international. So we do, on the one hand, have to be very cognizant of and respect traditional needs and rights, of course, and other ways of knowing. But we also have to acknowledge that the world is changing at a rate which is just extraordinary. And some of these sometimes there needs to be a compromise, or at least a discussion about what a compromise could look like in this new world, right? I think this is another thing. It's not a one-sided discussion, right?
Yeah.
If we consider this a global common good, we all got to work together somehow.
Yeah, absolutely. No, I think that just shows that what we're trying to do with our work is really complex, and maybe it also responds to this issue we've been having in developing these interventions around upstream prevention. It is a very complex picture, definitely. So I know we're out of time, so apologies for that, and I'm very sorry that we had to start a bit late. But thank you so much, Chris, for your fantastic presentation. It was really, really helpful to know everything that WCS is doing. And on our end, of course, we have made those connections. I know Lucy you perhaps have been in touch with people from our partner organizations, because there is, of course, a lot of, I think, synergy and complementarity with the work. Claire, you mentioned wildlife health surveillance. Mongolia is one of the countries we're working in, and WOA is leading there. So certainly it's very, very relevant to look at the wildlife health net, I think it's called, and all the work that's being done under that. That was really very interesting to see. So I'll just close off here. We will have the recording available on our website, I think in a couple of days. And if it's okay with you, Chris, we'll have the presentation also. We'll share that with everyone just so that they have that at hand as well. And yeah, hopefully we can do this again soon. But for now, thanks very much for joining, and all the best. Thank you.
Thanks so
Can you
much.
just share the one?
Thank you.
Can I just say I'll send you a new version to share, because
Yes,
I
of
found
course.
some
No
spelling
problem.
mistakes. So I'll share it.
No problem at all. Thank you so much.
Thank
All
you.
right.
All right.
Thanks,
Thanks so
everyone.
much, everyone. Thanks.
Bye-bye.
Bye.
Thank you, Chris. Thanks, everyone. Bye.